channel. I hope you guys are doing well. This video I decided to do because I know when I was a nursing student, studying is life. All you do in nursing school is study. This is what I did to help me succeed in nursing school. If you want to succeed in nursing school, keep watching and I will show you some tips on how to prepare yourself for exams. Let's get started. Now, I know you're gonna feel like you don't see the light at the end of the tunnel. You feel like nursing school is lasting forever and you just feel like it's never gonna end. Trust me, I know. That's how I felt when I went to nursing school. You're studying 24/7. You're always stressed because you just want to pass, you want to do good, you want to succeed, you want to be a good nurse. It's normal to feel that way. Continue watching this video and I will show you some tips on how to succeed. To start off, something that is very important with nursing school, becoming a nurse, is critical thinking. You really need to think and reason with everything that you're doing as a nurse. While you're doing something, you ask yourself, like, why am I doing it this way? I'm doing it this way because of this. You're asking yourself reasons behind your actions. You're asking reasons behind everything and anything. You're giving a medication. Well, what's this medication for? Why is this patient getting this medication? And how is this going to help this patient? Because if you just do things just to do them, then anybody can be a nurse. Whenever I studied, I literally had like the table full of books and papers, and I even had my wall full of sticky notes. That's how I studied. I was constantly, it was kind of a disaster whenever I had to study for an exam. And then the people that lived with me, my husband, which was my boyfriend at the time, and my sister, they were just like, oh my goodness, Nat, we can't see the table, or Nat, I'm just like, hey, I have an exam to study for, so you gotta suck it up. Let's begin. So let's start off with notes that I used to do in order to help myself study. I'm gonna show you this here. In the middle here, I have diagnosis. So you literally write what the diagnosis that you are studying for. Hypertension. Patient has high blood pressure. And below I have written etiology and definition. So etiology, so what causes high blood pressure? You could write down the cause of the diagnosis, or you can put it somewhere else. This is just an example of what I did. You can either follow it or you can just take some and leave some, really up to you. The etiology, and then I also wrote the definition. So like, what is hypertension? Up here, I wrote signs and symptoms. So what are the signs and symptoms of high blood pressure? So you write them down. Your signs are what you see, and your symptoms is what you don't see. Think of it, sign as like a sign that you can see it, you know, like I see a sign. Interventions. What kind of interventions are you going to do for the patient that has hypertension? What kind of interventions to help with that? Here is risk factors. So I have it separate in two different sections. So you've got risk factors that are non-modifiable and risk factors that are modifiable. Things that you can modify. Person smokes. Well, get the person to quit smoking. That you can modify, you can change. You can't modify is it runs in the family. They're at risk of having that high blood pressure, hypertension. Teaching. A nurse is constantly teaching patients things. We're teaching them how to get better. We're teaching them how to do things. We're teaching them about their diagnosis. We're teaching them, literally teaching them everything. So a nurse is also a teacher. Actually, a nurse is a jack of all trades. And then at the bottom here, I have written complications. What kind of complications can occur if you have hypertension? Now, as you can see, I love my colors. I ran out of markers, so this one is not colored. But this is just an example of what you can do to help you study. You can either take it or leave it or use part of it. And honestly, sometimes I have to use more than one paper though, because sometimes it can get full, you know, depending on the diagnosis and depending on the complications and depending on what is the diagnosis, because sometimes there's like different types and that can just go on and on and on. In my binders, I identified like all my different systems. So like the cardiovascular system, I had put it in a plastic, and then I had all my cardiovascular system behind this. And this was in a binder. Your urinary system. I used to also print out pictures because I'm a very visual person. So if you're very visual, pictures are awesome. And I mean, I encourage you to print out pictures and stick them on your wall. You know, when you're studying, stick them on your wall and study. And a big thing whenever you are studying, there are certain things that you're learning to learn by heart. Let's say like names of medication. Well, you're trying to remember the names of the medication, but you're also giving yourself tricks to remember those names. But whenever it comes to diagnosis and stuff like that, and even the types of medication, it is so important to know the rationale and the reasoning and the reasoning behind it. Let's say somebody has high blood pressure and I don't know, they ended up having a stroke. Well, what is the reason behind the stroke? Is it because of the high blood pressure? Because what does the high blood pressure do to your vessels? Like, I want you to go into depth, into detail. That's how it's going to stick with you. Like, you really, really, really want to go into depth. You really want to go into detail, and you want to go into reasoning. I know me, if there was something I didn't understand, I asked like, okay, why this, because of that, or why? Because I found whenever I knew the reason why, it stuck more with me. I was able to put it together and I was able to remember it more easily because I knew the reasoning behind it. When you don't know the reason behind something, it can be a little bit difficult to remember it. Repetition is also a really good way. I used to study and then I would take a bath at night and I would just talk to myself like, okay, this medication is for this, and then name all the different types of those medication. I used to literally talk to myself. Like whenever I was out of my books and I went to go take my bath, and I'm not saying to do this all the time, it's very important to also relax and to ease your mind and to not think about it, because sometimes, yes, it can get stressful. But whenever you are hardcore trying to study and you really want to pass that exam, this is what I did. I used to study and then I would go take my bath and I would constantly just talk to myself. Like if I was talking to somebody else and be like, what is this medication for? And what is it going to help with? This patient is diagnosed with this. What are interventions? What can I teach this patient in order to get this patient feeling better, or to help this patient, I should say? What are complications that occur with this diagnosis? And what kind of risk factors play a part in that diagnosis? There is just so much little detail that you want to study for, and it's just so important just to know the reasoning behind it and to just use it and have confidence in yourself. Another perfect and great way to study is to study in groups or with another person, because that person might have another way that they study and you might actually really like it, and you say, oh, you know what, I actually like that, I'm going to use that. There is not just one good way to study. There's many different ways, and sometimes a mixture of different ways are awesome. And sometimes you will find the way that you prefer the most. No, I rather study by myself because I can concentrate more, and that's all right as well. It's whatever works for you and whatever helps you concentrate and whatever helps you succeed. What also helps a lot is videos. If you are visual like I am, I liked to look at videos and watch videos on whatever I was studying on. I find that was super helpful, and I really hope this video is very helpful for you whenever it comes to studying. And if it is, please let me know. Please let me know if there is something that you would love to hear about. I would love to help. If you're anything like me, I'm very visual, and I needed to see my notes. I need to highlight things in color. I needed to visualize everything. Please remember to take breaks whenever you are studying though. You might feel like, no, I don't have time. I need to get this all done. I need to cramp all this information in my brain and pass. No, because if you keep studying and studying and studying without taking any breaks, your brain is just going to be so tired. You're going to be exhausted. You won't be able to retain any more information because you are just going to be blank. Because after a certain amount of time, you just can't retain any more information. You just can't. So do something for you. Either go for a walk, take a nice hot bath, do a yoga session, go exercise, just go take some fresh air outside, just anything. Even go out for supper or go out for a lunch or just something just to change your mind. Get your mind away from it for a little bit, just to give yourself a little break. Because if you don't give yourself a little break, you're gonna end up even more stressed and more tired. And like I said, you're not gonna retain any more information. You need that break. It's so important. Now, I'm not saying a break of like, I don't know, 5 hours and then you're like, okay, I'm done studying and I'm ready to go. No, I'm just saying a little break for the brain, you know, take an hour and or two, whatever you feel comfortable with, and do what you love. Do what makes you happy, do what makes you stress-free, and do that for a little bit, and then go back to your studying. I really hope this video was helpful. If it was, please give it a thumbs up, and please subscribe to my channel if you'd like to see more content like this. I do plan to do a mixture of content. As you can see, I have a mixture of nursing, of life itself, and a little mixture of my life actually as well. So if you do like what you're watching, please subscribe, and I will see you in my next video. Thank you.